Good afternoon. This is Dr. Deuk, and we're live streaming a sacroiliac joint Deuk plasma rhizotomy. This patient presents to us with multiple problems causing back pain. His back pain is emanating from damaged discs, facet joints, and the sacroiliac joint. We picked up on the sacroiliac joint source of the pain yesterday in clinic when we examined him. Turned out he had tenderness and pain localized to the right sacroiliac joint. Dr. Patel is now performing the Deuk plasma rhizotomy procedure on the right sacroiliac joint. The sacroiliac joint becomes painful when it's injured and there is inflammation within the joint. The inflammation causes swelling and pain, which those pain signals are then transmitted up to the brain and perceived as back pain. The sacroiliac joint is one of the more common causes of chronic back pain. Alternative treatments to the sacroiliac joint include physical therapy, chiropractic therapy, injection of the joint, and fusion of the joint. Rhizotomy of the joint has been performed. Rhizotomy shortcomings include that it doesn't work often, and if it does cause temporary relief of pain, it is only temporary. The pain returns usually within a few months, requiring additional treatment. The Deuk plasma rhizotomy has been developed as a more permanent treatment where the nerves that bring pain signals from the sacroiliac joint up to the brain are destroyed. They're destroyed by thermal destruction as well as transection. Transection is a process whereby a surgeon cuts something, in this case the sensory nerves to the sacroiliac joint. By transecting those nerves, you eliminate pathways of pain from reaching up to the brain. People ask me, well, if you don't feel your painful joint, doesn't that cause more damage to the joint? No, it doesn't, because the joint itself is already damaged, and eliminating pain from the joint doesn't damage the joint in any way. You can see Dr. Patel is targeting the pain nerves as they run from the foramen over to the sacroiliac joint. The nerves he'll be targeting are the L5 dorsal ramus, which he's just completed doing, and the S1, S2, S3, S4 sacroiliac joint dorsal rami, which innervate the SI joint. Deuk Spine Institute developed the Deuk plasma rhizotomy technology to provide patients with a permanent solution to painful arthritic joints. We are now performing Deuk plasma rhizotomies for arthritis of the hip, the knees, and the shoulder as an alternative to invasive surgery such as fusion or artificial joints. This procedure will take approximately 15 minutes to perform. Normally the patient would recover for 30 minutes and then they would be discharged from the facility. With the Deuk plasma rhizotomy, there is no downtime. Patients could be back to work the next day. There is mild discomfort from the procedure, which is treated with Tylenol. There is no need for painkillers such as opioid narcotic painkillers after this procedure. There is minimal to no bleeding. The amount of blood loss for this procedure would be a few drops, maybe totaling 1 to 2 cc's. Dr. Patel is working with Dr. Davis, our orthopedic surgeon, and Luis to perform the treatment. You can see the sacral foramen on the X-ray. He'll be wrapping up the procedure in just a few minutes. You can see the incision there. It's tiny, 3 millimeter incision. It's covered now with the gauze, but this incision requires just a band-aid to close it. And there's no downtime from the procedure. Should be finished up in a few minutes.